Welcome to a brief talk on rashes. Many people develop rashes, and the older you are, the more likely you are to develop a rash. This is because the skin becomes thinner and dry with age. Dry skin is more likely to develop dermatitis. Applying a moisturizer to dry skin reduces the risk of developing dermatitis. The three most common rashes are dermatitis, also called eczema, Tinea, also called ringworm, and psoriasis. Well over 90% of people who have a rash have one of these three. Dermatitis is the most common cause of a rash. As mentioned before, dermatitis is more common the older someone is. If you have a red, scaly, itchy rash, it's most likely to be dermatitis. Patients with dermatitis often suffer from asthma and/or hay fever. This disease complex is called atopy. A-T-O-P-Y is pronounced atopy. It's an inherited condition, and someone in the family or the patient usually has dermatitis, asthma, or hay fever. People with atopy are most likely to develop dermatitis, asthma, and hay fever, but they're also more likely to suffer from migraines, urticaria, also called hives, itchy eyes, and drug allergies. One way to think of atopy is that the patient has a sensitive outer lining of the body. The skin, lining of the nose, lining of the lungs, and blood vessels in the skin are more likely to be irritated and react to the irritation. The irritant can be dust, could be pollen, could be soap, could be any chemical. This picture shows a typical case of dermatitis. The rash is red, it has a fine scale, and it's itchy. The rash blends in to the surrounding normal skin. Dermatitis can develop on any part of the body. The hands are commonly affected by dermatitis because the hands are used a lot. And the picture shows typical dermatitis affecting the hands. There's a fine scale on skin that is redder than normal, and it's very itchy. Dermatitis is usually red and scaly, but occasionally it can be severe with blisters developing. This is a severe case of dermatitis caused by an allergy to a foot spray. Tinea or ringworm is a common cause of a rash. It's caused by a fungus, and the fungus is usually picked up in a public place such as a swimming pool. The feet are usually infected first, and then the fungus can be spread to other parts of the body via a towel or by scratching. This patient has tinea infecting the soles. The soles are scaly and slightly redder than normal. Tinea on the body is a circular rash with a raised edge and a clear centre. Dermatitis does not have the raised edge and does not have the clear centre. The reason for the raised edge and clear centre is that the immune system attacks the fungus and kills it. However, the fungus grows faster than the immune system's ability to catch up to it. The picture shows the raised edge with the clear centre on the back of a freckly man. The nails can be infected. They're thick, yellow, and crumble easily. The nails act as a reservoir of infection. This is one of the reasons why some patients keep getting tinea, because the nails are the reservoir and have to be cleared of the fungus in order to stop reinfection. The groin is often infected. In this patient there is the raised edge and a clearing centre, but the clearing centre is dark in colour. This is because inflammation has caused a stain. The stain will fade over time if the fungus is eliminated. You should realise that dermatitis is a more common cause of a rash in a groin than tinea. Dermatitis does not have a raised edge. Skin scrapings should be taken and sent to a pathologist for examination before an antifungal cream is applied. Otherwise, the sample will be contaminated and a fungus might not grow. This false negative result could lead to a delay in obtaining the correct diagnosis and the correct treatment. Psoriasis develops in about 5% of the population, and most cases develop from middle age onwards. It is uncommon in children. Usually there is someone in the family who has psoriasis. Psoriasis most often develops on the elbows and knees. The rash is thick, the scale is fine and silvery and easily scraped off. The underlying skin has a pink colour. There is no raised edge with a clear centre. Psoriasis can be itchy. The picture shows a typical plaque of psoriasis. The skin is thick, the scales are silvery, the patch is itchy, and the patient has scratched the scales off in a few spots, leaving shallow ulcers. About 30% of patients with psoriasis develop arthritis. That's the most common disease associated with psoriasis. There are other diseases that are more common in psoriatics. The diseases associated with psoriasis include high blood pressure, high cholesterol, inflammatory bowel disease, depression, and inflammation of the eyes. Psoriasis is not just a skin disease, it is a systemic disease. That's the end of the talk. If you have a rash, see your GP. You'll have a few things to discuss